eventually. So we have a cardiologist here to talk about, what we need to know about Heart Healthy Month. His name is Dr. Stephen Reisman. How are you?
Good. Nice to be here. Thank you.
Well, we might need you after all of these.
Yeah.
Looks like
what
it
do
a
you
lot.
think of all this?
We're believers in the Mediterranean diet, so whatever's on that
Is there
diet.
a hummus in here?
Yeah, basically omega-3 fatty acid foods.
So what are 3 things that we need to know about keeping our heart healthy?
So 3 things you need to know about keeping your heart healthy. The most important is exercise. Exercise in a proper amount can decrease your risk of heart disease by up to 30%. We recommend for all our patients at the New York Cardiac Diagnostic Center a simple program called the 30 and 5 program. 30 minutes a day, 5 days a week of brisk or rapid walking. 150 minutes a week. That's the program at a minimal level that's been shown to decrease risk for heart attack and heart disease. Number 2 is diet. And diet is, again, as I mentioned, Mediterranean diet. It's a diet that's one of the few diets that's been shown also to decrease risk of heart disease. It's very important with omega-3 fatty acid foods such as fish, certain types of fish, salmon, tuna, herring, sardines, and also nuts, fiber, and vegetables. So that you can look online and find out about it. And the other very important thing about prevention of heart disease, really to get screened with blood tests to make sure that the individual is not having a high cholesterol, diabetes, high blood pressure. The major risk factors for heart disease are high blood pressure, diabetes, hyperlipidemia, strong family history of heart disease, obesity, and things along those lines need to be looked at in a general examination by one's physician.
At what age should someone start to do that?
Well, as far as blood tests goes, that can be over 18 years old because we know that it's a long-term process of building up plaque in the arteries with high cholesterol. So over 18 years old, every 2 to 3 years, it's not a bad idea to get a general physical exam.
What about those of us who genetically have higher cholesterol? I'm one of those people, and I'm not anywhere in the danger zone or whatnot, but I'm above average, we'll say.
So if you have above average...
Always.
If you have above average cholesterol and it's not in the danger zone, so to speak, we always start with the lifestyle modifications I mentioned, which is exercise and diet. When you check your cholesterol and blood test, it's always important to do it on kind of in a fasting basis in the morning before you've had a meal. If that doesn't work, then you have to see your physician and determine whether you're in that risk group that should be put on medication. Not everybody needs medication, but depends on what your evaluation is by your doctor. There is another entity called familial hypercholesterolemia, which is very high cholesterol genetically, and that's a whole different ballgame. Those type of individuals frequently need a relatively new medication that's injectable to bring the cholesterol down on a monthly or twice monthly basis.
So since you started your practice, some things have changed, haven't they? The world of insurance, the world of just the way patients walk through the door. Our whole relationship as consumers with doctors has radically evolved in the past 20 years.
Yes, the things have really changed. That's correct. For instance, 30 years ago, probably 80% of the cardiologists in the United States were in private practice. Now it's probably 5 or 10%. A lot of the cardiologists have found it very difficult to maintain their practice and have joined hospitals or, hospitals have taken over their practice. But insurance, we accept a lot of insurances at the New York Cardiac Diagnostic Center, so we still try to maintain that type of ability to see patients, but it becomes difficult all the time.
Yeah. My father was a cardiologist, and my brother's a cardiologist in Pennsylvania. Shout out to Dr. Andrew Waxler. And his practice is now affiliated with a hospital. And it was before as a private practice, and so many changes, even from when my dad practiced.
Right. Yeah, it's definitely changed a lot. The advantage of our practice here in Manhattan is that we can, when you call the hospital, you have to hit 5, then 10, then 50. By the time you get done, it's a 2-minute phone call.
And you have heart issues after that.
Yeah, exactly. You call us up and you reach us right away. There's none of that type of effect. And we can see patients within 2 to 3 days usually. So we're able to, not have you wait a month to see a doctor, but it gets more difficult over time, no doubt.
So one of the things that we're dealing with is that the population is getting chubbier and chubbier and chubbier and chubbier.
You're talking about me in this.
No, you're not chubby at all, please. Here in New York, we're not like that, but the rest of America, one of the most notable things when you get off the plane leaving from New York is that people are heavier, and they seem to be getting progressively heavier. What do we do about public health and, as the baby boomers age, are we going to see our healthcare costs skyrocket because a lot of them are going to have cardiac issues?
Yeah, well, we do see this obesity in New York frequently. People will come in obese and having shortness of breath and various symptoms, and clearly a lot of it has to do with the obesity. There's no doubt that obesity is a risk factor for not only for heart disease, for development of diabetes, high blood pressure, and these in and of itself are risk factors for heart disease. So obesity is a very, very big problem in this country. It needs to be attacked, I think, very aggressively with weight loss, diet, nutritionists, dietitians, and eventually some people actually benefit from like gastric bypass surgery where they can't be successful with the standard treatments and they lose weight that way. And we've seen people who are diabetic on insulin come off insulin once they've had that surgery and lost weight. So that's really something to consider if other modalities have been unsuccessul.
I have multiple friends who have done that.
So
and
do I.
yeah, and then after that they're so confident and happy and they move around, feel more comfortable in the gym, so it's almost fulfilling.
They still have to keep on a
They
certain
keep it up,
diet.
but they feel better about it. It's easier for them.
We've seen some real positive results with people.
Yeah.
Of course, we always try the standard treatment, with some exercise,
Yep.
weight loss. Some people try Weight Watchers. Some
Yes.
people have various different ways they try to lose weight. It's not easy.
Totally. When I was pregnant, I ended up having to go on a strict diet because I had gestational diabetes, and it forced me to lose so much weight. I gained some with the baby weight, but I ended up coming out of it so much thinner
Right.
when I started. So if
unfortunately, that's a temporary situation. So
Yeah.
that's a good thing. That's temporary.
So, just easy notes here for young people. What do we need to do to protect our heart?
Young people is a little different story. So we know that there's a certain risk of sudden cardiac death in athletes.
Oh boy.
And that's something that we should maybe speak about for a minute or two because, people in the 18 to 35 age range, there is a certain risk and you best to be screened if you're in competitive sports. See a cardiologist at our office at the New York Cardiac Diagnostic Center. We'll perform a history and a physical, make sure blood tests were done, do an EKG and frequently an ultrasound of the heart because one of the causes of sudden cardiac death in athletes is the thickening of the heart. It can also be an electrical arrhythmia, So those are things that we screen for. Over 35 athletes, it's more of a risk for general heart attack or blockage situations. So it depends on the age group, but certainly the younger individuals who are doing competitive sports should be screened, and there is a benefit to doing that.
Well, anyway, thank you so much
Yes.
for taking the time
Pleasure.
to talk to us today.
Pleasure.
We appreciate it.
Yes.
Thank you. Thanks for inviting me.
Thank you.